So once again, my name is Attorney Dawn Blagrove. I am the Executive Director of Emancipate NC, which is an organization that is dedicated to ending mass incarceration, dismantling systemic and institutional racism, while centering the voices and the lived experiences of justice-involved people and their families. One thing I can say for sure is that Medicare for all is a necessity for everyone in the country. But very, very often, the most marginalized parts of our population are not considered in these discussions. And I'm happy to be here to bring their voice to this important issue and to this table. And that is the voice of folks who have been justice involved or their families. So what we know for sure is that in the United States, we incarcerate more people than any other industrialized country in the world. We also know that disproportionately the people that we incarcerate are Black and brown people. We also know that as a result of over-policing and over-incarceration of Black and brown communities, there is a plethora of health-related issues that are seriously exacerbated because of their justice involvement. There are one of the, actually, ironically enough, incarcerated people in America are actually the only group of people that have a guaranteed right to health insurance per, or to health care, I should say, per the United States Supreme Court. However, the level of care that they get is de minimis, and it is less than humane. And one of the things that the terrible pandemic has really exposed is the disparity in healthcare and the disparity in health outcomes for everyone. Right now, North Carolina's prisons are in a state of emergency with the spread of COVID. That was completely unavoidable and completely not necessary. And if we had Medicare for all, and there was a universal system that applied to all people, including those who are incarcerated, we would have access to better healthcare inside of our prison facilities. And those folks, we would have been able to do a much better job of containing this spread. Just like in any other congregate living facility, like college dorms or nursing homes where we see these explosions, except that those folks are considered higher on the American caste system than incarcerated people are. So they are getting even less care. We also know that once those people who are currently incarcerated leave incarceration and try to matriculate back into society, that their mortality rates are somewhere in the neighborhood of 4 to 5 times higher than your average citizen who has not been incarcerated. And that is because of the woefully inadequate medical care that they're getting on the inside, which necessarily exacerbates underlying health conditions, particularly communicable diseases inside of prisons, Hep C, HIV, other sexually transmitted diseases. And when they leave, because of the way that Medicaid is set up, very often formerly incarcerated people are excluded from even having access to the most basic health care. And also, we know that healthcare is not just an issue about access to healthcare. It is a holistic issue. All of these issues are intersectional. And we know that because I read an article yesterday that said the average person or a Black, somewhere in the neighborhood of 50% of Black men in this country between the ages of 25 and 65 will spend some period of time incarcerated. Of those folks who spend time incarcerated, that means that necessarily about 13% of their working lives, they are unemployed. They are not employable and they are not working. The impact that has on the families of incarcerated people and the communities where incarcerated people live and the health outcomes cannot be overstated. We have got to be very, very sure that when we create Medicaid for all, and we should create Medicare for all, and it should be something that happens, and it should be something that Representative Ross supports and backs strongly. And that is because as we try to come out of this pandemic as a country, and we are facing the harshest economic conditions that we've seen as a nation since the Great Depression, what we know is that those on the bottom always suffer more, always end up worse off. The Black and Brown communities that have already been ravaged by COVID cannot afford not to have adequate access to healthcare, cannot afford for the disproportionate number of us who come out of prison and try to find jobs and can't, and therefore can't get access to healthcare because they can't get quality jobs, and then become the burden of their own families that are already struggling. It's just a spiraling cycle that cannot be ignored any longer. Healthcare, especially now that the prison systems and our jail systems have become our de facto mental health facilities, we cannot afford for any American not to have access to adequate health care, not to have access to continuity of care, not to have access to the medications that they need to maintain a healthy lifestyle, to food that they need to maintain a healthy lifestyle, to access to fresh food. And we know that in poor communities, Black and Brown communities specifically, there are food deserts. There are so many things that go into the need for folks to have adequate health care. So I'm going to wrap up by just saying that I am here to speak for those folks who very often do not get a seat at the table, who are very often not considered in these types of conversations. And those people are disproportionately impacted Black and Brown folks who are touched by the criminal justice system and who suffer from the collateral consequences of that carceral involvement for decades and sometimes generations. Medicare for all can help break some of those generational cycles, can help create equity that we have talked about and we have heard talked about so much in the healthcare industry and in the healthcare realm. And ultimately, when everyone has access to healthcare, we are safer as a community and we are safer as a country. We are better as a community. So thank you, and I hope you will consider making sure that you are specifically addressing incarcerated people, formerly incarcerated people, and making sure that when we get Medicare for all, that there are no access barriers that limit their ability to get that care. Thank you.